Hey Adirondack Club family, it's Colin bringing you this week's Coach's Quarter, and this week we're going to talk about ACL injuries, and specifically in our female athletes. I filmed a video a while ago, and I figured I'd film another one since it's been a minute. So when we look at our female athletes, they have a much higher risk than our male athletes, and depending on the research study, they're anywhere from 3 to 8 times more likely to tear their ACL than a male. And I worked as an athletic trainer for many years, and we definitely saw that where we were getting more, 2, sometimes 3 ACL tears in a season with a female team, and maybe none or 1 in our male teams, and predominantly in our football operations. So they're definitely at a higher risk, and there's some things you can't control with that. Okay, some of the risks is we look at is Q angle, so how wide your hips are compared to where your knees line up. So then, kind of in that knock knee, it's going to kind of put you in that position that it's hard to get out of when our knee caves in, and we see a lot of like ACL, MCL, meniscus tears, especially on that inside of your knee. Your female athletes' ACLs tend to be a little thinner, so they can't withstand as much force. Can't really do anything about that. There's a little notch in there that helps stabilize the knee. That's tends to be a little bit smaller in female athletes, so they don't have as much stability there. Can't do a whole lot there. Now there are things you can control. When we look at our growing female, as they mature, they tend to store a little bit more non-propulsive mass, or fat mass and other things. When our males go through puberty and mature, they're tending to produce more muscle, right? Propulsive mass that they can help control their body weight in space. So our female athletes, as they're going through puberty, like that's a big important piece of the pie, is making sure you are strong enough to do it your sport. And we see a lot of quad dominance in our female athletes. So making sure that balance in the knee with the backside, the hamstrings and the glutes are strong enough to withstand and decelerate. So a lot of our non-contact ACLs are deceleration and change of direction. And that's going to require a ton of muscular load and stability in order to do those things. And sometimes that's where we see our ACL. So we can't think about what you can't control. We've got to think about what you can control. You can control whether you're doing 2 strength training lifts a year throughout the year. You can control, really important one is getting enough sleep. Okay, there's more and more research coming out that your increased risk of injury if you get a poor night's sleep increases acutely, especially on a one night, but multiple nights, you're also increasing your risk of getting injured and your brain not being able to process what's going on in a game, and also get your body in the right positionings. Managing your year-round play. We've got athletes who are playing 12 months a year of their sport, a single sport, and that fatigue is mounts up, and then you go to a game, maybe you're not playing the way you should be because you're just tired, and that's when the injury. Kind of the next piece is recovery. Are you recovering? Are you doing your foam rolling? Are you getting enough food? Are you getting enough rest? Are you doing all the things you need to be doing in order to make your body feel the way it needs to feel so you can compete at the highest level? Obviously, off seasons, we're seeing less and less off seasons. They're getting smaller and smaller. And then lastly is fueling appropriately. So if you're going to play hard, we see a lot of our athletes that don't fuel appropriately, and if you start to get fatigue in the game because you haven't fueled, that's where we tend to see where you reach a leg out, maybe in soccer, and do something that you normally wouldn't do because you're fatigued, right? So you got to focus on the controllables. We think strength training and stability training is a really big component of that to help reduce that. Other areas you can look at is looking at your warm-up. The FIFA 11 is a research-backed program. There's a couple others that involve jumping that can reduce your lower extremity risk significantly, up to 60%, some of them, depending on the program you choose and how you do it. Those can be done on a sports field, and then those are things you can be doing on your own as well. So if you need help with your training, help train to help reduce your injury risk. And if you do get injured, getting back on the field as quickly as possible, reach out to our team. Our summer program is enrolling. We have programs running all year. Reach out to me and we'll get your athletes set up.